Have you ever wondered what it's like for the world to suddenly sound like you're underwater? Everything muffled, distant, disconnected. Well, for someone with a damaged eardrum, that's a daily reality. So today, we're going to take a look inside the incredible surgery that can actually bring all that sound back. When a patient says this, it's so much more than just a description. It's this feeling of isolation, right? It's a frustrating, disorienting barrier that suddenly popped up between them and the world. For a surgeon, this is the very first clue that something is mechanically wrong with their hearing. So think about it. The eardrum, or the tympanic membrane if you want to get technical, is this paper-thin structure that's basically the gateway to our hearing. Its whole job is to vibrate and pass sound waves along to the tiny bones in the middle ear. When it's damaged, that entire chain is broken. So how on earth do surgeons manage to repair such a crucial, delicate link? All right, so let's start with the problem itself, a perforation. But this isn't just a simple tear. It's really the starting point for this whole cascade of symptoms that can go from just muffled hearing to really serious infections and even dizziness. A patient's story almost always starts right here. The muffled hearing, that's the big one, of course. But you might also get fluid discharge, this constant feeling of pressure, or even tinnitus, that ringing in your ears, and vertigo. These are all signs that the middle ear, which is kind of like the engine room of our hearing, just isn't working right. So once a patient comes in, the surgeon's detective work begins. It's not enough to just know there's a hole. They need to understand why it's there, how big it is, and, crucially, what else might be going on inside that ear. This is one of the very first questions a surgeon is going to ask. And you might wonder, why does that matter so much? Well, a sudden hearing loss, that often points to some kind of physical trauma. But a gradual decline, that suggests a more chronic issue, like long-term inflammation. The answer really helps build the case file for what's truly going on. Now, this next question, this one is absolutely key. It might sound unrelated, but it's not. Smoking dramatically affects the tiny blood vessels in our tissue, and that can seriously compromise how well a person heals after surgery. A successful outcome can literally hinge on the answer to this question. Okay, so next up, the surgeon uses a microscope to look inside the ear, and they're looking for more than just the hole. They might see that the eardrum is retracted, kind of sucked inwards, which points to a pressure problem. They could also see these chalky white patches, which are basically scars, but the most important thing they're checking for is to see if those tiny, tiny bones of hearing have been damaged. And they'll even put a number on it. Doctors will actually quantify the size of the hole as a percentage of the eardrum's total surface. A tiny 10% hole might be handled very differently than a massive 50% one. This simple number becomes a really crucial part of the surgical plan. So the physical exam gives us a lot of clues, but to get the full story, doctors need to run tests that can measure exactly what's happening with the mechanics of hearing. This is the key hearing test. Think of it like testing a stereo system. First, they test air conduction. That's like playing music through the speakers. It tests the whole system from start to finish. Then they test bone conduction, which is like plugging headphones directly into the amplifier. It bypasses the outer parts and tests the inner ear's maximum potential. The difference between those two measurements is what we call the air-bone gap, and it tells the surgeon exactly how much hearing is being lost because of that mechanical problem. So here's the crucial point. This is what's called conductive hearing loss. The nerve that handles hearing, the inner ear itself, is often perfectly healthy. The problem is purely mechanical. Sound just can't get to where it needs to go. And you know what? That's actually great news, because mechanical problems can almost always be fixed. So you've got these 3 tiny bones in your ear, right? Well, one of them is particularly vulnerable, the incus. And the reason why is fascinating. It just has the poorest, most fragile blood supply. So in cases of chronic inflammation, it's usually the first of the hearing bones to get worn down and break the chain. It's the weakest link. For the more complex cases, the surgeon has a secret weapon, a CT scan. This basically gives them a kind of X-ray vision, a super detailed 3D roadmap of all the delicate bone structures inside the ear. With this scan, they can walk into that operation with 0 surprises, knowing exactly what they're up against. All right, the detective work is done. We've got a roadmap. Now, it's time to rebuild. The procedure is called a tympanoplasty. The surgeon often borrows a tiny piece of the patient's own tissue from right near the ear. It's this tough layer covering a muscle, and it's the perfect patch material. It's strong, it's thin, and because it's the patient's own tissue, the body won't reject it. They then gently lift the skin of the ear canal, clean up the edges of the hole, and just slide that new patch right underneath. Then everything gets carefully packed to hold it in place while it heals. This is where you really see the incredible foresight of a surgeon. They know all the common pitfalls and have these amazing strategies to prevent them. For example, to avoid something called anterior blunting, where the graft heals at the wrong angle, they'll meticulously tuck it into place. To stop it from moving away, they'll secure it to one of the little hearing bones. This is a game of millimeters, and every single move is calculated for the best possible outcome. Okay, the surgery was a success, but the journey's not over yet. The healing phase is every bit as critical as the operation itself. So what does that healing journey look like? Well, it's pretty straightforward. After about a week or 2, the packing comes out. A huge milestone is around 6 to 8 weeks. That's when the graft is finally strong enough for the ear to get wet again. But the final result, well, that's not known right away. And to make sure everything heals perfectly, there are a few golden rules for the patient. Keeping the ear dry, that's the obvious one. But things like no forceful nose blowing or avoiding air travel are just as important. Why? Because they prevent any sudden pressure changes that could literally pop that delicate new graft out of place before it has a chance to heal. So if there's one big takeaway here, it's patience. The final hearing test, the big reveal, is performed at the 3-month mark. It just takes that long for all the swelling to go down and for that new eardrum to fully settle in and start working at its absolute best. And that really brings us to the future. I mean, this surgery is already incredibly precise, but innovations are happening all the time. But the next frontier, it could be custom 3D printed implants that give a perfect, personalized fit for every single patient. It's just a fascinating look at how technology is helping to bring the world back into focus for those who've been living underwater.